This is Tammy Hernandez, and this is my presentation of my teaching and learning strategy, which is algorithms, and this is in partial fulfillment of my N5309 teaching, learning theory, strategies, and evaluation. The topic I chose to cover today is the correct technique for swaddling a newborn, and I've kind of depicted a little bit of an algorithm here on the wall, and we'll go over that in more detail in just a few minutes. The reference group that I'll be using for this demonstration is beginning nursing students, and I will have my two teenage sons who will be acting as my new nursing students. Again, I went over algorithms, which is a step-by-step strategy to help learn, making choices. And let's go through our outline. And the history of swaddling goes back way through prehistoric man. There are depictions on cave walls of babies who are swaddled. It's in all the history books. Almost every different culture uses a form of swaddling for their newborns. There's been different versions of it. Some are extreme, some are not very, well, I can't say useless, but I wouldn't say, they don't really do anything for the baby, but we're going to cover at least two of them today. The number one thing that I was really surprised with was around 1500s, when swaddling started showing up in medical books, was the amount of superstitions that were the reasons for the swaddling. Part of the superstition was that snakes would invade the babies through their mouths, so people would tie up their babies or swaddle them and actually hang them from trees, and this was to save them from the snakes getting into them. They think now, looking back on that it wasn't so much that there were snakes getting into their system, but possibly the superstition was developed from babies who were passing tapeworms, so people thought snakes were inside. Another reason for swaddling were medical interventions, and number one was warmth, which is something that we still follow today. Even as soon as a newborn is delivered, we tend to put them under the warmers, we wash them, and we bundle them up and give them to mom. Another medical intervention was for molding crooked extremities, and now that with more research, we're finding out that actually swaddling babies incorrectly can cause hip dysplasia. So they might have had the right idea, but in a backwards way. And another reason for swaddling is a calming reflex, and we do know that that is actually a benefit to today's swaddling techniques. Again, like I said, a benefit of the correct swaddling is that swaddled babies have been shown by research to sleep better and longer, and this is especially true of babies who are withdrawing from drug addiction or being born addicted to drugs, or even possibly any kind of post any surgical interventions from following birth or in the newborn period. Swaddling has also been shown to make a baby more responsive to stimuli, and also to help soothe pain, again going back to the surgical interventions, that helps with the pain. And also swaddling might have a positive effect on neuromuscular development, where they can actually, their extremities aren't flailing in all directions, and they're able to possibly fixate on one object, and by studying it a little longer, they're developing a neuromuscular development. Detriments of incorrect swaddling: overheating. We do have family members, and usually this goes back to the grandmas, and this is what I teach some of my newer mothers, is if it's a 100-degree day, the baby does not need to have blankets wrapped up on them, sweaters, and hats. If the baby's really red and hot, that could also overheat the baby, causing dehydration. So really, if you're comfortable, that's what we teach the mamas. You don't need to swaddle at all times. Development of hip dysplasia, again, we're going back to where we were earlier with incorrect swaddling. Not aligning the extremities correctly can cause the hip dysplasia. Increased risk of respiratory infections. Studies and research show that once a baby's able to kind of turn over on their sides or to turn themselves over, usually after about the second month, maybe the third month of life, they really don't need to be swaddled anymore. If they're able to turn themselves over, then you don't need to be tying them down, because that way they're not able to clear their secretions quite as easily as when they were smaller. And also, if a blanket is too loose, there's a possibility of suffocation. There's never any reason for a blanket to be in a newborn's crib or even a small child's crib because of the risk of suffocation. So what we're going to go through today are a demonstration of two techniques, and one is a traditional quick wrap, and the second one is a hands to face wrap. And if we look back on my little algorithm that I have here on how to swaddle a baby, the first thing we ask is if your baby is fussy. Now, if your baby is fussy, not fussy, then we really don't need to swaddle the baby and just a happy baby, leave him where he needs to be and make sure he's safe and leave him there. Now, however, if your baby is fussy, there are a couple of questions that you do need to ask. The first question is our baby a term baby, which is greater than 36 weeks gestation? And that one they would recommend the traditional quick wrap. And if our baby is a pretermer, which is, it's said 36 to 37 weeks, just depending on the baby's, how the baby's reaction is and how advanced the baby is. Well, in this case, if it's a preterm, like I said, 36, 37 weeks, let's just go with a hands to face wrap. And that's because babies have a chone in utero that they do like to have. They suck on their fingers, they suck on their hands, and that's the only way a baby can console themselves. So the reason they like the hands to face wrap on preterms more is so that they can keep their little hands to their mouth and suck on their fingers if they need it. It's a lot easier for them to put their fingers in their mouth and suck on them than it is to hold a pacifier, whereas a more term baby is able to have a stronger suck and keep the pacifier in their mouth. So now I'm going to go turn it over to our students, and we will demonstrate the different types of wrapping techniques. Thank you. Okay, so here I have my nursing student, Dominic. I picked a new male nursing student because they tend to be a little more anxious with newborns. So, Dom, tell me about your baby, please.
It's a 38-week term baby.
Okay, so she's a 38-weeker term baby, so we're going to go with a traditional quick wrap. Okay, so can you demonstrate? We're going to go ahead and grab this side. Our hands and our legs are going to be straightened out, so as you roll it over, you make sure your hands are down to the side and that the legs are straight. Tuck that underneath. Okay, now pull up the base here, this corner. Tuck it up over the shoulder, making sure the other little hand is down, and tuck it underneath. And pull this out here a little bit. Now tuck. Okay, then we bring this down over and pull, get your corner here, and pull it up and over, wrapping your baby in a traditional quick wrap. Can you show the audience? Thank you very much. Lovely. Okay, so now I have Matthew, who's my other student, and tell me about your baby, Matt.
My baby is a 35-week-old male.
Okay, so according to our algorithm, is he term or preterm?
Preterm.
So what technique are we going to use?
Hands to face.
All right, let's demonstrate together. So let's get our first hand, and we'll wrap it up to us right below his face, right there at his little chin, and we get the blankie, and holding that, we bring it over and tuck it under your baby there. Tuck it under. Okay. Now bring up your bottom corner here and tuck it up around you. Okay, let's get your hand and tuck that hand up to his little face too. And we're going to hold that in place, and we bring this corner, tuck it under his shoulder here to keep him nice and tight. Okay. And now we bring our other corner here. Let's get this because we're going to get it tight. Fold it down tighter, a little tighter. Okay, because we don't want to loose blanket. Bring it, wrap it up and around, and then fold it up under him. Let's do this way. Let's try a little. He's tiny, so, and this is not uncommon. Okay, so we have our hands to face technique. Okay, so that was my demonstration using the algorithm, and as you can see again, here's our checking to see if our baby's fussy. If no, then just leave it alone. If yes, then we determine whether it is term or preterm, and from there we use our traditional quick wrap to our hands to face wrap. I hope you enjoyed my demonstration. This is Tammy Hernandez. Thank you, and good luck on the course.